Next on our presentations is Carenow Healthcare Private Limited. Subhabrata Paul is going to present. Subhabrata Paul serves as a co-founder at Carenow Healthcare Private Limited, where he leads product development for the company's suite of digital healthcare solutions. With a strong background in healthcare innovation and product design, he focuses on deploying varied products in the AI ecosystem. Mr. Paul, you can come over.
Hello. Good morning, everyone. So good morning, everyone. I know there is some technical glitches while the presentation comes up. As mentioned, I'm the co-founder at Carenow Healthcare Private Limited. That's the company name. Probably many of you must be familiar with our brand name, which is CarePlix. There you go. This is the So as I was saying, many of you in this house must be aware of CarePlix. So we are an health tech company focusing on building AI tools, leveraging your smartphone and without any kind of wearables or devices. So the primary thought that we had is like most of the population don't have access to the different devices or wearables. Let's say many of us don't know how to use a blood pressure monitor, how to use them, but almost 70% of the world's population carries a smartphone, and everyone today knows how to take a selfie, how to record a reel, and that is where we thought of why don't we leverage the same thing and convert that into a health monitoring tool. So we leveraged the smartphone, and with the help of AI, we have been building different health monitoring solutions, which gives your vital parameters, doing different facial scan, and I will definitely go deep dive into what the products that we have been building. So today I'm gonna talk about mostly on the claims to care, is like enabling proactive, preventive, and intuitive health management for insurers with our CarePlix Unity Health platform. So a little background of CarePlix. So we started officially in 2020, but we started in 2017 with the research, where we started collecting data. Our first presence was in US, where we started with a chronic care management platform, and we have been capturing data to train our models, and finally in 2020 when we decided to launch it in the market. So during the COVID, we were done with our clinical trials. We were submitted our submissions for the license under the CDSCO. That time COVID hit, and there was a black marketing happening with the smart oximeters. So many people were not being able to buy oximeters. Price was huge, and so that time we didn't think of anything. Our intention was always to release it into the B2B market, but we directly launch it in the Play Store and App Store. In just 3 weeks, we saw 3 million user base without a $0 spent on any kind of marketing. And people understood that time. We understood like what is the demand, like how a smartphone can be used as a health monitoring tool, and almost like 100+ media houses covered us. And again, as I was saying, we didn't have today also we don't have a PR team or a digital marketing team for us. So everything is inbound and organic, and based on the feedback that we get from the market and from our customers. And also, we started with 2 different regions, India, US, and now today we are present in Middle East. and in Africa as well. And we started operating in Saudi Arabia as well very recently. So today, so there are two parts of health monitoring where we say that know your health and improve your health. So what we do after knowing our health, there is there has to be something to take care and improve our health. So that is where improve your health comes into picture. But as I today I will be particularly focusing on the know your health side with our Unity Health capabilities, like what are the tools that we have been building. So Unity Health is basically a complete ACMD platform suite which has different health assessment engines. First I would like to talk about Vitals engine, which we initially built and which is our flagship product. Using your facial or finger scan, we give you more than 20 plus health parameters in just 60 seconds. So it's just like taking a selfie. You record, you just hold your phone camera like this while we scan your face, and we get all your body vitals in less than 60 seconds, which includes your heart rate, blood pressure, respiration rate, stress level, heart rate variability, and many more. We have a Palmo Engine, which based on your vocal acoustics. So you have to provide your vocal samples like a cough sound and a vowel R sound. And based on that, we extract certain features from your vocal acoustics, and we have trained our model, which gives you the FEV1 by FVC ratio, which is equivalent to your spirometry test. So it's kind of a digital spirometry where we are giving you a risk prediction, whether you have any kind of chronic conditions, obstructive airway disease conditions like COPD or asthma. Similarly, we have Derma Engine, where we ask the user to take a facial image or any of the skin area where you have any kind of rash or anything. The AI model analyzes what kind of disease you have and what needs to be done. We give you the recommendations, and based on that, you can go and get yourself checked with a particular dermatologist. Similarly, we have Dental Engine, where you have to provide your the entire image of your upper teeth and lower teeth, and the AI again analyzes and gives you the overall health of your dental. Vision is something we know that today a lot of majority of our population suffers from dry eye. So this is where we thought of like developing a tool which can analyze and give you a risk of having dry eye. So we built an application where we ask the user just to watch a reel for a minute while they give access to the camera, and the camera actually observes your eyes. So how frequently you are blinking, what's your blink pattern, and the blink rate, and based on that we give you a dry eye risk score. And the most important, which we see, in today's world, is the cognitive engine, the cognitive balance test, where we have different test batteries, which is similar. Is basically different games, small games like for 5 to 10 minutes, which you need to play. And based on that, we understand different domains of your cognitive balances, like attention. Then you have your memory, learning. And based on that, we give you a score of your cognitive health. So based on all the different engines that you see, we create a unique score, which we call it as a Unity score. So it's our own proprietary score that we provide, along with all the parameters. And this is how we have been monitoring individuals' health. And it's not just on the cardiac side, it's on the lung, where we are doing with the pulmonary, along with the mental balance with the cognitive side. So talking about the Vitals engine, as I said, that it's our flagship product which we launched in 2020 during the COVID. And today we work with most of the insurance companies where they have already started adopting this facial scan technology. And as you know that there has been a digital transformation going on from a physical health assessment to a digital one. And vitals, facial scan has been has played a very important role in this particular transformation. When we currently do all the digital health assessment, just sending a link to the customer, who just opens and does a facial scan, and the insurance companies knows what risk factor they are currently at. So the underlying technology, there must be a question like how you can get all these vitals just by looking at a facial scan. So the underlying technology is called PPG technology, or the R-PPG technology, which is remote photoplethysmography. It's not a new technology, it's a very old technology that we leverage on our smartphones, smart wearables. Instead of the infrared, we leverage the ambient light, and that's the only difference between the PPG signals that we get from the wearables and the facial scan. So there are different intensities that we capture, RGB, and as we know that when there is a blood flow to our cheeks, it absorbs the light. And that is where we capture the intensity differences, and every time the blood pumps, we capture the intensity differences and we get the PPG signal. PPG signal is equivalent to your ECG signal, and based on that we get certain direct outputs like heart rate variability. Some of the parameters like blood pressure and HbA1c risk, we have models. We have trained our models with collecting data from different government hospitals in India, in US, and some of other parts of the world. And today also we collect the data. As I speak, there is a clinical team who is collecting data, and as we know that more and more data is, we keeps on improving our accuracy of our models. So like blood pressure, HbA1c risk, all are basically a predictive outcome, not a direct outcome from the signals. So these are the vitals that we generally provide. On the key body vitals, heart rate, blood pressure, respiration rate, and oxygen saturation. Stress is very critical. We see a lot of interest from different corporates for monitoring stress levels, and there are different use cases that we have already implemented, where an organization wanted to see the stress levels of all their employees. And recently we have introduced a BMI scan. Initially we used to capture height and weight from user input, but as you know, in insurance there is always a probability of having fraud with providing the wrong BMI, or sometimes the user don't understand the centimeters or feet and they provide some wrong data, due to which the BMI calculations goes wrong. So we are having an AI model which gives you BMI directly from your facial scan. So you just, while doing the facial scan, we analyze the face and gives you the kind of predicted BMI. So Careplex is clinically validated. Definitely, this is a detailed report, and we have all the certifications. Careplex Palmo, as I was saying, is through your vocal acoustics. So about the certifications, so we are CDSCO Class B certified, which falls under as a software as a medical device. So both our Careplex Vitals and Palmo applications are Class B medical device certified by the CDSCO. And all our products that you see, all are under US FDA Class 1, which falls under the general wellness. And we are HIPAA compliant. We are completely partnered with AWS, and we also hold the ISO certifications. We have a data sphere where we kind of integrate our dashboards, provide the solutions to our customers. Recently, we integrated a dashboard for our oil and gas company in the Middle East, where they want to track like what is the risk level of their employee population in different regions, onshore or offshore rigs, and to do their analysis, and based on that, so it's basically an analytics tool of the entire health landscape that we have generated. For the last couple of years, we have been working with some of the key clients, and there are different use cases. So we started working with Aditya Birla Health Insurance within their active fit policy. One of our health partners is Philips Healthcare. Philips Healthcare has their heart print application for a cardiac screening, where they leverage CarePix solutions. We work with Cipla, one of the leading pharmaceutical companies, where we do public screening for understanding the hypertension risk and other parameters like HbA1c risk or a diabetic risk that I say. We work with a leading hospital group in Middle East, Mubadala Health, M42, where they have integrated the solutions within their application to drive user engagement. And in South Africa, we work with a lot of medical schemes, starting from Key Health, ProfMed, and MedScheme, and MedShield is there, and Bonvi. And in February 2025, we have seen a huge, with Active Fit from Aditya Birla, where they have completed more than 4.2 lakh screening. And the most important thing to highlight here is their MPS score was recorded as more than 75%. We work with Indoco, which is another pharmaceutical companies, and where they have taken our different solution, which I am not presenting over here, but it's a smart ring, which I am wearing currently. So it's our own in-house product, which we call it Loop Ring by CarePix. So as you know, the facial scan or any other scan was a single time screening, but this ring is a continuous monitoring where you get almost similar set of vitals, but on a continuous level, like at every 5 minutes interval. And these are some of the clients with whom we have been working for so long. Most of the insurance companies and life insurance companies like Aviva, Max Life, and we also work with SBI General. We work with ICICI Lombard, Aditya Birla. Some of the use case I will just give. I know there is not much time left, but some of the use case is in insurance companies have seen it's quite a challenge, I would say, for insurance companies that to have an adoption or a daily stickiness within their platform. I mean, we don't use our insurance application unless and until we feel sick or get hospitalized, and that's the biggest challenge in this insurance world, because everybody wants to have increase their user adoption or user stickiness. Everyone wants their apps to be opened every day, and this is where we came into the picture. And with integration of CarePix solutions, the customers, even though they are not hospitalized, they come open the app daily, spend some time doing a facial scan, monitor their health, and that has increased the user stickiness within the platform, and as well as user engagement and the adoption. Can you just quickly play the video?
Welcome to the Unity Health Experience Center, where advanced health intelligence meets the simplicity of your smartphone. Here, every scan brings you closer to understanding your well-being. Face Scan Health Risk Overview, a quick facial scan that reveals vital signs and overall health indicators, helping you take control of your wellness in seconds. Respiratory Health Check, assess your lung performance and detect early signs of respiratory stress, all from a simple breath captured by your phone. Dry eye risk assessment. Instantly evaluate eye moisture levels and identify early dryness patterns using advanced visual analytics. Cognitive balance scan. Gain insights into your focus, memory, and mental agility with clinically aligned cognitive tests right at your fingertips.
So it's a bit lengthy video, so I would ask to a bit pause the video for a while. This is something that which I spoke for the last 20 minutes is just all the applications, and I know it will be a lot of time to go through each and application and see a demo and experience the same. Slide. Yeah. So that's our mail ID, and that's my LinkedIn. You can just scan the QR and send me a text, or you can just drop a mail, so that we can send you a demo access and we can take the discussion forward, because that's a lot of things. I think within this short period of time to go through all the demos will be very difficult. So I mean, just drop a mail and we are happy to have a session where we can showcase a demo of each and every application that we have, and have a detailed discussion. Thank you, everyone.